COVID-19 Coronavirus Disease 2019. Presented by Assisted Living Training School. What is Coronavirus Disease 2019, COVID-19? Coronavirus Disease 2019, COVID-19, is a respiratory illness that can spread from person to person. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. How does COVID-19 spread? The virus that causes COVID-19 probably emerged from an animal source, but is now spreading from person to person. The virus is thought to spread mainly between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. It also may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. Learn what is known about the spread of newly emerged coronaviruses on the CDC website. What are the symptoms of COVID-19? Patients with COVID-19 have had mild to severe respiratory illness with symptoms of fever, cough, shortness of breath. What are severe complications from this virus? Some patients have pain in both lungs, multi-organ failure, and in some cases death within the elderly population. How can I help protect myself? People can help protect themselves from respiratory illness with everyday preventive actions. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. If you are sick, to keep from spreading respiratory illness to others, you should stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. What should I do if I recently traveled from an area with ongoing spread of COVID-19? If you have traveled from an affected area, there may be restrictions on your movements for up to 2 weeks. If you develop symptoms during that period, fever, cough, trouble breathing, seek medical advice. Call the office of your healthcare provider before you go, and tell them about your travel and your symptoms. They will give you instructions on how to get care without exposing other people to your illness. While sick, avoid contact with people. Don't go out and delay any travel to reduce the possibility of spreading illness to others. Is there a vaccine? There is currently no vaccine to protect against COVID-19. The best way to prevent infection is to take everyday preventive actions, like avoiding close contact with people who are sick and washing your hands often. Is there a treatment? There is no specific antiviral treatment for COVID-19. People with COVID-19 can seek medical care to help relieve symptoms. What you can do? One of the most important things you can do is stay informed. Pay attention to trusted health resources, such as the World Health Organization, Centers for Disease Control, and your local health authorities. Now is also the time to review your response plans for any potential crisis. From developing a business continuity plan to evaluating HR policies regarding leaves of absence and determining how best to communicate with your employees and customers. What your employees can do. You and your employees should take simple preventive measures, as recommended by health officials. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer with at least 60% alcohol. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Stay home when you are sick. Avoid touching your eyes, nose, and mouth. Prepare masks for your residents and employees. Stock up some supplies, food, water, etc. What are we doing as a group? We have to create a support systems in place to help you manage events that could affect your business and your employees, including health issues such as COVID-19. Assisted living community should have a comprehensive business continuity plan that ensures the smooth continuation of business operations despite the potential for temporary office, store closures. Actively monitoring COVID-19 as it affects our customers, employees, and their communities. Continue to understand how businesses such as yours are responding to the outbreak and to assess their preparedness and their concerns, so that we can proactively help them with their business issues and operations. Preparing our service organization with updated information to properly answer our customers' questions. Providing an online resource center to help you respond appropriately should the virus affect your business, including information on workplace health, business continuity, and answers to frequently asked questions. Guidance for limiting the transmission of COVID-19 for care homes. How should facilities monitor or limit visitors? Facilities should screen visitors for the following. 1. International travel within the last 14 days to restricted countries. 2. Signs or symptoms of a respiratory infection, such as a fever, cough, and sore throat. 3. Has had contact with someone with or under investigation for COVID-19. If visitors meet the above criteria, facilities may restrict their entry to the facility. For updated information on restricted countries, visit the CDC website. How should facilities monitor or restrict facility staff? The same screening performed for visitors should be performed for facility staff, numbers 1, 2, and 3 above. Employees who have signs and symptoms of a respiratory infection should not report to work. Any staff that develop signs and symptoms of a respiratory infection while on the job, should immediately stop work, put on a face mask, and self-isolate at home. Inform the facility's infection preventionist, and include information on individuals, equipment, and locations the person came in contact with, and contact and follow the local health department recommendations for next steps, for example, testing, locations for treatment. Reference. Refer to the CDC guidance for exposures that might warrant restricting asymptomatic healthcare personnel from reporting to work. Facilities should contact their local health department for questions, and frequently review the CDC website dedicated to COVID-19 for healthcare professionals.